Well, good morning. This is Dr. Mark Cooper again. And today I want to talk a little bit about an overview of fibromyalgia to see if it can help you with a general perspective and maybe help you be a little bit more motivated to make some of the behavioral health changes that seem to be of benefit and why those behavioral health changes are being suggested by many healthcare providers. But fibromyalgia basically is a condition of widespread pain throughout the entire body, mostly in the muscles, but it's in all four quadrants. So you hurt your knees muscles, the knees, in the chest. The arms hurt when you squeeze them. This hurts. You get pain here. You get pain in the hips and the back, and everything hurts. And one of the diagnostic ways of looking at fibromyalgia is that if you poke on your chest or a patient's chest or any of these areas, the instead of the pain or there, first of all, it hurts when you do it, but then very quickly after that, for a normal person, that discomfort goes away entirely, so you don't feel it at all. But with a fibromyalgia patient, when you poke on there, it seems to linger 5-10 minutes. In bad cases, they may a patient may not even want you to touch them that much, and very frequently, a telltale sign of a person with fibromyalgia is that they don't really like to be touched by their husband or their wife too much. They don't like massages. They can't go into massage therapy. They don't like physical therapy, usually makes them worse. And so those are some of the telltale signs that the person may have fibromyalgia. So they got pain in all four quadrants. Also, there seems to be a non-restorative sleep pattern where people get up tired and they don't sleep very good and they don't get that deep stage sleep. They also have GI problems like irritable bowel and acid reflux and irritable bowel syndrome. And all those symptoms are part of the whole complex. Sometimes there's adrenal fatigue, sometimes there's thyroid problems, sometimes there's a weight gain issue with it. So typically, if you're a person with fibromyalgia, you may have a lot of different symptoms, and it may not be just fibromyalgia alone. You can have fibromyalgia then, but you can also have arthritic conditions, and you can have lupus and Sjogren's syndrome, and rheumatoid arthritis and polymyalgia rheumatica, and so there's a lot of things that can go along with it, and you can have this on top of all that. But it is a real condition, and it does cause psychological disturbances because you just don't feel like doing anything that you used to do, and your quality of life goes downhill. And so then, on top of all those things, you can get some depression and anxiety. I really haven't seen that the depression and anxiety has been the primary underlying cause of fibromyalgia in the first place. And that's not been the tack that I've taken as a psychologist. 20 years ago, I looked at it that way, but over the course of time, I haven't really seen that as the primary underlying cause, but it can be one of them. It just depends on the individual person. Um, so, so what's the underlying cause? Well, we don't have a good understanding of what that really might be. In the medical field, or in that area, the theory is that we have hypersensitivity of the nerves, and that there is a increased amount of substance P in the peripheral tissue, which means substance P is the neurotransmitter that sends the pain signal to the brain. So you got hypersensitivity, and so that kind of justifies the use of the Lyricas, the Cymbaltas, which is an antidepressant, the gabapentins, and the Savellus, and those are the medications we typically use for treating fibromyalgia. However, that's not the but that doesn't answer why the hypersensitivity developed in the first place. Well, in natural medicine or in natural health, one of the views that I've come about to believe in is that there is really an over-acidic condition, or there's an imbalance in the pH system of the body. And if you can balance that out, you start, changing that hypersensitivity in period. And that's kind of been a mainstream effort, and one of the reasons why I've tried to get people to change their whole lifestyles. And so basically I see fibromyalgia really is a lifestyle problem brought about by, environmental toxins, food sensitivities and allergies, and really a poor diet and a lack of appropriate exercise. And so I typically have taken a natural health approach, and really for two reasons. One, it gives the patient back some locus of control so they can make some changes in their lifestyle, and that helps that person feel like they got control over the pain. And over the years, that's really been a benefit to people, where they've kind of made these changes and really have made some significant improvement in their pain complaints, and also in the underlying psychological variables that were there that were brought about because of their pain. So my treatment approach has been to, first of all, not put them in really aggressive exercises, because it appears that aggressive exercise, especially strengthening exercises, increase lactic acid in the muscle, which I think is one of the underlying causes of it. And so I usually start with people working on the fibromyalgia as make dietary changes. So I'm going to try to change their underlying diet to an alkaline diet. And pretty much like there's a guy named Dr. Brody who wrote a book on alkalize or die. And basically he was talking about getting your diet 80% fruits and vegetables and 20% all the rest of the stuff. And that's kind of where I've focused on. When I was doing a lot of research in cancer prevention, at Gershwin Institute, they were really trying to get people to eat 5 times the amount of foods, and you just couldn't eat that much, so they ended up juicing a lot to get the nutrition in, and it was all fruits and vegetables. So that's the primary thing I try to do first, get a person to switch to 80% fruits and vegetables, and then and give up all the acid-producing foods, or many of them. And the primary ones, you've got to give up the cigarettes. I've not gotten people better who continue to smoke, because that keeps your body acidic. So you've got to give up the cigarettes. You've got to give up all the sodas. You've got to replace that with other sort of drinks that are not so toxic for that individual. I mostly stress on water, and sometimes alkaline water, at least purified water, or high pH water, 9.5 water, and I've talked about that in some other videos. And then there are some supplements that seem to be of benefit, because as your body's acidic, you start losing some of your minerals. And you watch to make sure the irritable bowel symptoms and all that start resolving sort of slowly. So the diet is the first thing. The supplements would be the second. And the supplements, usually magnesium is one of the ones that I see people are deficient. Not so much calcium, but mostly magnesium. And then some of the B complexes. Another thing is the omega-3 essential fatty acids, whichever form that they can get, they can take. It might be flaxseed oil, or it could be borage oil, or it could be omega-3 essential fish oils. I also like one, so it doesn't get so complicated. I like to get a vitamin or a supplement that has multiple ones in it, like Omega Q Plus, which has got CoQ10 in it, plus L-carnitine, which helps the energy, and then it's got the high levels of DHA in it with the calamari oil, and then it's got B6, B12, and folic acid. So I think those are all beneficial. So sometimes there is an underlying nutritional deficiency in people. And by the way, a clue is that if a person has got fibromyalgia and has had a gastric bypass, you can pretty well be certain that they've got some nutritional deficiencies. Then after they've been on that diet for about a month to 2 months, and their oral pH and their urine pH is beginning to shift, with these strips, you want to try to get them to about 7.4, the patient to 7.4, or if you're watching this as an individual, you want to try to get yours to about 7.4 in the morning in your mouth. And of course, your urine pH is supposed to be a little acidic because your body's dumping acid, so that's kind of common. But generally speaking, that puts your body in the environment where it combats most bad diseases, including fibromyalgia. So and that may take 2 months to get there. And in the meantime, I would like the patients just to sort of do a walking program. So they're just kind of walking in the evening, not getting out of breath, or maybe a stationary bicycle, or elliptical scene, or swimming. I don't care what kind of exercise it is. One, as long as there's not an orthopedic issue that's involved, So if you got bad knees or ankles, or you may have to switch to a bicycle rather than a walking program. But whatever it is, you get some. So you want to improve the circulation, but you're not doing any strengthening exercises at this point. Okay. So the steps: first diet, supplements, then beginning aerobic exercise. After you do that, then you start, the fourth step would be start some strengthening exercises for the whole body. And at that point, I like to use rubber tubing exercises because it doesn't put so much stress on the specific joints. And so I'll have people, or you could start in using some rubber tubing exercises. So you might want to look at the video on those rubber tubing exercises that I suggest. That's in an earlier video. And so you'll start those, and then after you're able to do that, and at pretty high repetitions, then you might be able to go into some more weight training with free weights or track weights. So that's the sort of the step in terms of the physical part. Okay, so you got diet, alkaline diet, or anti-inflammatory diet, supplements, aerobic conditioning, and then strength exercise is last. In the process, psychological support usually needs to be done because it's kind of hard to make all these lifestyle changes, and sometimes family members are undermining you and sabotaging you and bringing the wrong things in. So through the whole process, we provide psychological support to the person to make those behavioral health changes and help them understand the underlying reasons why you're doing this. And so that's that's the behavioral health psychological component there. And you're always going to find if a person can't make these changes, there's almost always an underlying psychological reason why they're having that trouble. But basically, again, it goes back to the whole concept: make food and exercise your medicine. But that's the things that a person can control in themselves. You can't control what medications the doctor's going to give you, and sometimes this approach does not restrict other physicians or surgeries or other medications that you might want to take or need to take. It's just an addition or complement to what's already being provided. So I think it works really well. It's just that these lifestyle changes are difficult to make. Before I end this presentation, I do want to mention one other thing about some extra supplements that might be of benefit as people have made their lifestyle changes and are in this process. Sometimes there's some actual supplements that are really beneficial to help overcome some of the individual specifics of fibromyalgia, like for example, acid reflux. If you have acid reflux and you've gotten off the diet, but it's not off the bad diet and on to a good diet, but it's not quite enough, then sometimes, drinking about aloe vera juice about that much, mixed in some water or other juices, can be really helpful for the irritable bowel symptoms and the acid reflux symptoms. So you can, as you go along, you might want to add some extra things. Also, and there's a previous video on talking about that you can look at as well. And if you got a lot of arthritic complaints as well as the fibromyalgia, so you got joint pain too, then there's some other supplements like curcumin and ashwagandha and boswellia and bromelain that may be a benefit to you as well. And you might want to look at that. And there's I did a video on that earlier as well. So you might want to look at it as additional things that you might be able to incorporate in your supplements and in your program. And again, I hope you get better. Thank you for listening. This is Dr. Mark Cooper. And remember, make food and exercise your medicine.